Representative Janal.
Thank you, Madam Chair.
Wait, just a minute, please. Mr. Kohler, please read the title of House Bill 1168.
House Bill 1168 by Representatives Janal and Danielson, also Senator Scott, concerning the continuation of the Rural Alcohol and Substance Abuse Prevention and Treatment Program.
To the bill.
Thank you, Madam Chair. I move House Bill 1168. There are no committee reports.
I did. To the bill.
Thank you, Madam Chair. This is a sunset bill on the continuation of rural alcohol and substance abuse prevention and treatment programs. The Rural Alcohol and Abuse Prevention Program meets a key need in rural Colorado, and the program provides critical treatment services to people addicted to alcohol or drugs and the vital prevention and treatment services for rural youth. This bill extends rural alcohol and substance abuse prevention and treatment programs through September 1, 2025. I urge for a yes vote.
Representative Danielson.
Thank you, Madam Chair. It is a pleasure to serve with you. I would just like to also urge an aye vote on this bill. This is about providing some much needed support for communities around the state, rural Coloradans, who, if we can do some youth prevention education and also help with some detox services, will really help these communities. And I would certainly appreciate your support today.
Is there further discussion on House Bill 1168? Representative Landgraf.
Thank you, Madam Chair. Members, this is a good program. It's completely funded by fines that people who get DUIs pay, and then they turn around and they give that money to rural Colorado to help with drug and alcohol abuse amongst youth. So there's no fiscal note. It's just a win-win situation, and I think it would be really sad if this went away. Thank you.
Thank you. Is there further discussion on 1168? Representative Brown.
Thank you, Madam Chair. And just a few questions. You know, when we have, I know this was passed, I think, I can't remember what year it was passed, I think 2009. But do you have any data showing, you know, how things have improved in the rural areas regarding these funds and this money?
Representative Danielson.
Thank you, Madam Chair. Thank you, Representative Brown. We did have the department come in and describe some of the advances that have been made, the programmatic work being done in our schools, the availability of the detoxification centers to the rural community, transportation in between, that kind of thing. The question was asked of the department leadership, and it's kind of a hard thing to gauge. We're providing these services. They evaluated the program and its efficacy and the impact on people in these rural areas and decided that it was absolutely a program that should be maintained and continued, precisely because it was providing assistance to the people in those communities. They did acknowledge the difficulty in measuring some of the positive outcomes when you're dealing with prevention work.
Is there further discussion? Representative Brown.
Thank you. That would have been interesting to be in the committee. I noticed that, you know, this is split between two departments, and you've got the Rural Detoxification Project, and then the youth substance abuse. There are 6 counties, 3 of which are in my district, that are getting the youth substance abuse. But what my question is on the rural detoxification projects. And I noticed that the Arapahoe House, and I'm wondering how rural these areas and these places are. The Arapahoe House, the Axis Health Systems, Colorado West Regional Medical Health Center, Crossroads Turning Points, Denver Health, El Paso County Sheriff's Office, North Range Behavioral Health, and Region 6 alcohol and drug abuse. Just wondering how those fit in with the rural detoxification.
Representative Janal.
Thank you, Madam Chair, and Representative Brown. Good question. In regards to those communities who are, I don't know whether you remember there was an article just recently in the Denver Post that stated that drug overdose deaths are reaching record levels in our rural communities. And heroin is on the increase, prescription drug, painkillers, cocaine, and sadly these deaths are in youth and in young adults. In regards to your question about the substance abuse centers, those people within those rural communities are brought into the substance abuse centers that are mentioned in this bill. So I hope that answers your question. It does help rural Colorado.
Representative Mr. Bush.
Thank you, Madam Chair. I can speak for one rural Northwest Colorado county, Routt County, which is covered under both of these programs. These programs are much needed. There is no other source of funds for them. And how appropriate that fines from drunk driving, fines from other sources go to fund these programs. With regard to Representative Brown's question, the Colorado West Regional Medical Health Center treats, excuse me, I'm sorry, I have a cold, treats patients from a wide variety of West Slope rural counties.
Is there further discussion? Seeing none, the question before us is the passage of House Bill 161168. All those in favor say aye. Aye. All those opposed? House Bill 1168 passes.